Applestosen. It's Dr. Bob here with another health and vitality tip of the week. So one of the most common things that people go to the chiropractor for is back pain. Here's the problem. Chiropractors are not back pain specialists. They are spinal alignment specialists to remove pressure on the nervous system. So if the spine is out of alignment, it's putting pressure on the nerves, causing pain, but you're also affecting the nerves that affect the circulation into the legs or the arms. You're affecting the nerve supply to the organs, and you could actually be developing a much bigger health problem if you're not actually looking at making sure that you're taking stress off the nerves. So if you're just masking over symptoms with a painkiller or an anti-inflammatory, you could be creating a much bigger health problem. If you look at this nerve pathway chart next to me, the lower lumbar area, meaning the lower back, all these nerves can create lower back pain. So if it's in the lower lumbar area, it can be coming from an alignment problem for the hips and pelvis. They're not out of alignment. It can be affecting the nerve called the sciatic nerve that goes down all the way into the feet. So just taking a medication to mask over the symptom and not actually realigning this area can also affect the bowel, bladder, and reproductive organs. These nerves are on the same circuit. So this is kind of like the fuse box of your body. If you have a blown fuse and the kitchen lights are off and the dishwasher's not working, then you got to go to the fuse box. You don't just go replacing the dishwasher. You actually look at where there could be a blockage from the brain to the body with a subluxation or this misalignment of the spine. If it's in the upper lumbar area, when a chiropractor does an evaluation, they can feel these different levels to see if they're moving properly, if they're in the proper position, and also evaluating the health of the shock-absorbing disc pads and the nerves themselves. If there's a problem here, it goes down only to the knee. So you might have a chronic knee problem, and you keep looking at the knee, and the knee joint looks fine, but it's actually affecting the nerves that come out from this area. And so realigning the low back, the lumbar area, affects the nerves that go to the lower back. This uncorrected problem goes to the nerves that go to the digestive tract. So you could be having a digestive problem in relationship to this knee problem and not have any clue that it could be coming from your spine. So it's important to not just mask over the symptoms of a back problem with a medication, but actually look at, is my spine in proper alignment? Am I moving properly? Do I have proper hip alignment? Is the motion and movement of my lower half of my body balanced? If not, it's going to create a lower back misalignment problem that needs to be corrected as opposed to being medicated. So make sure that you get your spine checked, look at your posture regularly, and until next week, this is Dr. Bob signing out. Applestosen.